Thanks, Kate. It's lovely to see you all, and I've been really enjoying hearing all the other work this morning. So hopefully, I can continue that thread. As Kate said, I'm program manager for Be Well based within the Greater Manchester Combined Authority, and I'm going to talk to you about all the things that we've learned through wellbeing measurement at scale in Greater Manchester over the last 3 years, and what our future plans look like. For anyone that's not familiar, Be Well is a partnership collaboration between the University of Manchester, the Gregson Family Foundation, Anna Freud, and in Greater Manchester, the GMCA. We also have a second location in Hampshire, Isle of Wight, Portsmouth, and Southampton, and then some other smaller sites that have adopted the Be Well measurement elsewhere within the country. And we have a mission to see an approach nationally around wellbeing measurement across our young people. The idea is that we want to raise the importance of wellbeing alongside academic attainment, and we do that using a co-design survey and publishing those results and working with schools and partners to really try and improve things. In 3 years, we've heard from 63,000 young people in Greater Manchester, which is about 55% of the young people in the year groups that we've surveyed. And we're currently underway with year 4 surveys as well, of which we've already heard from 24,000 young people. So really pleased to see just how many young people we're hearing from. We started by designing a survey with our young people. They told us what was important to them, what had an impact and an influence on their well-being. And what we came up with was this idea of domains and drivers, domains being those things, internal feelings, stress, life satisfaction, drivers being the things that have an impact and an influence externally on how they're doing, in terms of whether they do an hour a day of sport and physical activity, how they feel about the future and what job prospects they might have, a whole host of things. But the most important thing was it was based on what was important to them, and we continue to refresh that with them. What happens with all of that data is that, as I said, we publish that publicly. We think it's one of the unique things about Be Well is that we don't hold all that data in an Excel sheet or within a business intelligence unit. Actually, anybody can access that information, and we can share the link to the public dashboard. And if my tech works, the QR code in that bottom corner should show you that map of Greater Manchester, and there's a similar one for Hampshire, Isle of Wight, Portsmouth, and Southampton. And we're constantly looking to see how we might develop how we're sharing that data. So on the right-hand side there, you can see that we have evidence briefings, research reports, at-a-glance views that just show one local authority area, and also can overlay different measurements so that we can really focus support needed in particular areas. And for anyone not familiar with Greater Manchester, that map there is the 64 neighbourhoods that make up our 10 local authorities. So what we're able to do is see how young people are feeling in each of the neighbourhoods and compare it against that Greater Manchester average, and giving us that sense of local ownership. I'm not going to go through any of the data that we've pulled together. You can find all of that on our website, or go and have a look at the dashboard. But what we thought was important to share was what our, sorry, missing a couple of things, what's happened in 3 years. So we're really proud of the way that we have engaged with partners, from young people themselves, so put in investment into their hands, allowing them to pick what things in their local communities they want to spend money on, supporting them to become health champions and offer peer-to-peer support, developing campaigns around physical activity. We have worked with our coalition partners, which span our VCSFE sector, including supporting them with bids for additional investment, working with them, as Nick mentioned earlier, around utilising Be Well as a comparator data set and supporting them with outcome measures that might demonstrate the impact of the work that they're having, and developing toolkits to support organisations, particularly schools, with some of the issues identified within the data. We have done some great work with our schools. So schools get their own confidential data of which they can kind of dig into that and look at what priorities they might want to set and respond to, and have been able to think about within the secondary space, how do we support our primary schools to utilise that data and get ahead of some of the issues that we're seeing, and think about some of the alternative delivery programmes and projects that we can support into our schools, offering dance and youth work, to ensure that we're engaging all those different young people in those settings. We've also started to influence the thinking of our local government and health system. You can see on the screen there, supporting a paediatrician to think about how do you understand the whole young person in front of you within a 10-minute slot, asking them about whether they got enough sleep last night, and really just starting to pivot towards prevention and thinking about how young people are in the round, not just the issue that's been referred to them. I could have picked any of the 10 local authorities in Greater Manchester to specifically talk about what they're doing with the data in their area. But the most recent work that we've done has been with Rochdale and their children's partnership, and their new CYP plan is a great example of how Be Well can be part of the puzzle. So we've got loads of data insight that bubbles around in the CYP world, but how can we layer that all together and think about how we fill the gaps with qualitative engagement, as Rachel was saying earlier, working with young people to really understand why the data looks like that, and so what should we do about it, but then thinking about what that action plan is, what are we going to do about it, and really trying to make the most of the data that we've captured now, versus a historic approach of maybe sitting on the data for a long time, and future planning. What I was asked to think about today was less about what we've done in Greater Manchester, but what have been those secret ingredients, what have been those things that have helped us with the success that we have. As I said, we've been working for 3 years, and we're engaged for at least another few years in terms of continuing this work. And I could talk for hours about all of those different things. So I thought I would pick out a few different ingredients. And for those that know me, and I know that there are a few on the call, I love an analogy. I love to make it a little bit of something that you can imagine. So if you imagine that some of our ingredients that we popped into that mixing bowl over the last few years have been the things on the screen, for me, the things that we've learned about that success has been local ownership, co-design, working with partners, and the general sense that this data is theirs, as well as ours within the GMCA, the research team within Anna Freud and University of Manchester, and working with our schools on what was important to them, keeping it private, working with our partners so that they can utilise it through that publicly available dashboard. For me, impact is not just about additional project delivery or bringing in additional investment. It's about influencing thinking. We are trying to raise the profile of wellbeing, making it visible by collecting that data, but also connecting it to the work that other people are doing. And as you saw there from that paediatrician, that to me is where we're really starting to gain traction in influencing thinking, and making wellbeing a must do, not a nice to do. Another thing is having those operational as well as strategic allies. So within Rochdale, that example I talked you through there, we have people that are working every day with young people. We've got people that are working to support our schools, but we've also got the buy-ins of directors, chief execs, so that real sense that this is everybody's business, and that's what I think has enabled us to really get traction in some of those areas. Where we want to go further is some of that work around, and this is where you're going to have to stick with me on my analogy here. So if you imagine that we've got a pretty basic looking cake from those ingredients, we had to prove that we were here to stay. We had to be in this for the long run, not just a flash in the pan and that thing that was nice. So where we want to go further is where we start to decorate that cake, and it's where we start to really make it visible and memorable. We're doing some work at the minute to make well-being more tangible and, as I said before, must do, not a nice to do. Aligning with policy language that we've seen in various strategies, and really trying to make the case as to how that's contributing to improving well-being. And really going further in combining other data and insights. Well, Be Well is one ingredient in all of that work. And more than anything, making examples of action visible to share learning, so that what is happening in Oldham can be shared with Wigan and then around the country, and hence being here today. What we also have in Greater Manchester is a new ambition that is commitment to everyday support in every neighbourhood as part of our Live Well agenda. Our pivot to prevention in thinking about how we can get ahead of some of the issues that we're seeing, not just within data, but the experiences of our residents across the city region, and ensuring that everyone has the opportunity to live well. By attaching Be Well to that, we can provide data and insights about how our young people are right now, thinking about how we get ahead of some of those issues, but also support them in their lives right now, so that they don't manifest in later life in terms of other issues. But the overall mission is to make young people's well-being everybody's business. This is not something that sits within health or local government or youth work. It's something that everybody has a way to contribute. But how we do that is by making some of this work more tangible and connected to the language that's found in various different strategies that I've read over the last few months from our colleagues in violence reduction, our colleagues in education, work and skills, our NHS colleagues. So thinking about what is it that we can do to make the most of the Be Well insights, but make it easier for everybody to talk about what they're doing to improve well-being, so that we can attach it to this narrative. And so what we're starting to do is think about themes of happy, healthy, safer and stronger and successful, what data we have within the survey that can connect to that. But on top of that, as Rachel was saying earlier, the insights of what young people are experiencing in their lives right now, to understand what we should do about it, why the data looks like that, to then really co-design what we're going to try and do to improve all of that. This is very new. I'm talking the last few weeks that we've started to develop some of this. So I just thought it was worth sharing where our thinking at right now, given that we've done 3 years, but heading into our 4th year. I'm going to stop there and pass that to Kate, but welcome to take any questions, or there's contact details on the screen if anybody wants to get in touch.